Okay, so again, going back to the nervous system, quick, we're talking about milliseconds, and we're talking about action potentials. Okay? Later we'll learn that there are certain characteristics of action potentials that make such a miraculous system possible. The endocrine system also controls body functions. For those of you who are always hungry, and those of you who eat so much but don't gain any weight. Okay. Yeah, natuturuan na. I was pointing at everyone. Okay? If you do not gain any weight, but you eat, you eat like 4 people do at one time, you probably have a thyroid condition. Hyperthyroidism. But, note, for you to be able to feel the effects of any endocrine conditions, it's not instantaneously. It takes time. And remember that endocrine system, and I'm sure a lot of you don't like the endocrine system because it's so closely related to biochem. Because it is chemical in nature. Okay? I'm pleased to say that neurophysiology is not so related to biochem. Okay? It's more to anatomy and physiology. So what does the nervous system do? Receive sensory messages from the external environment. At this very moment, can you tell me what senses are working? Auditory, visual. Yes, the skin. What about the skin? What's working on the skin? Temperature. Your temperature receptors are working. What else is working? Your breathing mechanism, your cardiovascular system, your gustatory system. Why you're hungry? Okay? All of these systems are working at the same time. Imagine that, right? But, as I'm talking right now, which is the dominant one that's working? The auditory. Unless of course your mind is moving back to now, then it is your cognitive that is working now. Remember this, the mind can only focus on one thing at a time. That's the reason why, for students who are physically present, and I actually know, okay, having worked with undergraduate students, I have seen so many characters. I know who's listening, I know who's staring at me but thinking about something else. Okay? And I know who is actually attentive and is absorbing what I'm saying. So remember this, the mind, we receive sensory messages all around us. Even your clothes that you wear right now is actually sending sensory impulses to your brain. But we'll learn, when we talk about the sensory system, why you don't notice it anymore. Okay? Now, for the second function, it organizes information, integrates it with already stored information. The best way to learn something is if you can actually integrate it with something you've already learned. Right? That's where, as we were talking earlier, okay, for those who came in early, that's where a lot of schools fail. Because they don't make it conducive for people to integrate what they learn. They treat each and every subject in med school as a separate subject. When in fact, physiology, pharmacology, pathology, internal medicine, pediatrics, OB are all interconnected. You see? So, it does not facilitate proper learning. We use integrated information to send up messages to our muscles and glands, producing organized movement and secretions. Okay? The best way to remember this is, for those of you who play an instrument, how is it that when you play guitar, you are able to position your fingers so perfectly without even thinking about it. Muscle memory, very good. Okay? So your brain is the one responsible for those coordinated movements. And it provides the basis for conscious experience right now. Okay? As you are seated there, as you are conscious, okay, your brain is the one that's making it possible. Unfortunately, there's one part of the brain called the ARAS, which is the ascending reticular activating system. If you have a problem in your ARAS, not ARAS, okay, ARAS. If you have a problem with your ARAS, yes, you will be prone to a condition called narcolepsy. How does narcolepsy work? If you never watched Juice Bigelow, the movie with Rob Schneider, the first one, he had a date there who actually just falls asleep on the spot. That's how narcolepsy works. There is sudden loss of innervation in the ARAS, the ascending reticular activating system. For those of you who look like you're going to fall asleep now, okay, you are now losing signal to your ARAS. It's making you fall asleep. What's the best thing to do? One doctor actually told me, for guys, the best thing to do is to punch your balls. Okay? That sudden surge of pain going up your spinal cord is more than enough to send a lot of signals to your ARAS. Unless you punch it too hard, you become unconscious. Okay? For girls, I don't know. I don't know what you can do to keep yourself awake. For guys, yeah, think of happy thoughts. Okay, if your happy thoughts are about sleeping and dreaming, that's not going to work. Okay? So please remember this. Okay? Pain is also very good for the conscious experience because it actually helps keep you awake. Okay? But I'm not telling you to cut yourselves or do anything like that. So, the functional subdivision, we know that the brain has sensory functions. When we talk about sensory functions, it has special cells. Okay, special neurons. More commonly, we know them as receptors. We have different receptors for temperature. We have different receptors for pressure. Okay? Yeah, Basinian. Yes, Basinian for the pressure. And okay. We'll go to that later. Motor functions, like movement and walking. Walking alone and standing up involves more than 10 muscles at a time. How are those muscles all coordinated? Do you think about it? Okay, my gluteus maximus needs to tense up because I'm going to stand now. You don't think about these things. It just happens, right? So, because of the motor functions of your brain. Now, the integrated functions are more for the reflexes. Remember I told you, you're eating a shabu-shabu, you put your hand on the hot plate, what happens? You pull it away. You don't think about it, right? Okay, my hand is burning. Oh, my hand smells good. Maybe I can add it to the main course. Okay, you don't think about these things. You pull it away automatically. Now, the autonomic functions are the control of your blood pressure. After a very difficult biochemistry exam, what happens to your heart rate? I'm going to fail. I'm not going to make the second year. No. That's why I said autonomic functions. Remember this, your autonomic functions are connected to your cognitive functions. So if you start thinking negatively about your situation, the autonomic functions will follow. So you always have to be very positive about what you are thinking and what you are doing. The higher functions, and you actually need this in med school. Memory and learning. Okay? We're going to integrate, when we talk about memory and learning, I'm actually going to